Hello, welcome once again, and today we are going to look at primary ovarian failure, also known as premature ovarian insufficiency. We need to understand that primary ovarian failure is a rare condition. Though, given the fact that it is rare, it is a condition that affects a particular percentage of women in the whole world. What is primary ovarian failure? Primary ovarian failure, abbreviated as POF, means the ovaries stop ovulating. And by ovulating, specifically we are looking at the ovaries stop releasing eggs. And then also the hormones that are responsible for fertilization to take place and for the eggs to really be released. That is the follicle stimulating hormone and the luteinizing hormone. When they reach the ovaries, the ovaries stop responding to these hormones. So we've answered the first question, what is primary ovarian failure? And we've said that this is when the ovaries stop ovulating and they also stop responding to the hormones. We shall move on to our next point, and our next point is we need to understand that the problem is not with the glands. The problem is with the ovaries. In premature ovarian insufficiency or in primary ovarian failure, it is the ovaries that are having issues. So, having understood that the ovaries are the ones having issues and it's not the glands, we need to look at what do we mean by the glands. When you look at the brain of a woman, there is that particular base of the brain which is having two parts, two components. The first part is normally triangular shaped. It is called the hypothalamus, and then also we have the pituitary gland. The hypothalamus is that part of the brain which is responsible for releasing the gonadotropin releasing hormone, that is GnRH. The hypothalamus is that part of the brain that releases the gonadotropin releasing hormone. When the gonadotropin releasing hormone has been released in the hypothalamus, it acts also on the pituitary gland, which is specifically beneath it, and the pituitary gland releases the gonadotropins. The gonadotropins specifically are two hormones, and these include the follicle stimulating hormone and the luteinizing hormone. The pituitary gland releases the follicle stimulating hormone and the luteinizing hormone. Next, we shall look at what normally happens when these hormones have been released. The follicle stimulating hormone specifically works on the ovaries. Actually, when these two hormones, the follicle stimulating hormone and the luteinizing hormone, have been produced in the pituitary gland, they travel to the ovaries. And when they reach the ovaries, they act on particular parts of the ovary. Because we know that the follicle, the ovarian follicle or the egg cell, contains several key parts. There's that particular part which is in the inner layer known as the granulosa, and then there's the outer covering which is kind of a bit thickened, and it's actually what we call the Theca cells. So when the follicle stimulating hormone travels to the ovary, it acts on the granulosa cells making estrogen, and then of course the luteinizing hormone acts on the Theca cells making progesterone and androstenedione. Now progesterone, estrogen and androstenedione are known as the lipid soluble hormones, or they are also known as hormones which are in the steroid form. Kind of a bit complex, but we shall simplify it. We shall need to understand specifically that in the brain there is that particular part which is called the pituitary gland, and then also the hypothalamus. The hypothalamus releases the gonadotropin releasing hormone, which travels to the pituitary gland, and the pituitary gland is the one which releases the follicle stimulating hormone and the luteinizing hormone. These go to the ovaries, and then they lead to the production of estrogen, progesterone and the androstenedione. These are hormones normally which are checked by gynecologists to find out their levels. We shall discuss more as we proceed. Thanks a lot for staying with me. Remember to subscribe and like our channel, and yes, you will be able to get new videos we put out every day, and we shall proceed with our lecture. And we are saying that estrogen and progesterone and androstenedione are the hormones that are known as the lipid soluble hormones or steroids. The ovaries undergo changes, and in the primary ovarian failure, the ovaries stop ovulating and they also stop responding to the hormone. This was basically a recap of where we started from. We need to understand what are the treatments. Before we go to the treatments, we need to understand that to identify whether a woman has the primary ovarian failure, we always need to do what we call a fertility hormonal screen, where we look at those hormones specifically I talked about. That is the follicle stimulating hormone, the luteinizing hormone, and the progesterone and androstenedione. When these hormones are not balancing, more specifically when estrogen is low and follicle stimulating hormone is high, and of course even the LH is high, then it means we could be looking at primary ovarian failure. So when we go to the treatment of primary ovarian failure, we simply look at the hormone replacement therapy, and then of course in vitro fertilization. In vitro fertilization, sperms and the sperms and the eggs are got from donors. They are actually fertilized, and then they are put into this particular client, this particular patient, who they are inserted into the uterus of this particular patient with primary ovarian failure. The uterus has to be prepared and with hormones. That's when it will be able to carry this pregnancy. Remember, we are having issues with hormones. So thanks a lot for staying with me in this short lecture about primary ovarian failure. I'm really so excited to having talked to you. Remember, ask me all your questions, and you can also join me on my WhatsApp. My number is +256 701 7978 76. We can talk on a one-on-one basis. I'm really, and of course also you can join me on YouTube, Pregnancy Solutions with Gerard Massa, and we shall be able to connect via video. You'll be able to watch all our videos. This is the best channel for pregnancy. Remember to like and subscribe.